Good pet care starts with finding a good veterinarian. Maybe you already have a good vet. If so, stick with them. If not, or if you just added a new pet to the family, then we've got some suggestions for you. I'm Herb Weisbaum, a contributing editor at Checkbook.org.
Welcome to Consumerpedia at Checkbook.org. We're the nonprofit that helps consumers select services, avoid trouble, and save money. Because we don't accept any advertising or take money from any business we recommend, you can rely on Checkbook.org to be completely independent and objective. Now, here's the host of Consumerpedia, America's consumer expert, the consumer man, Herb Weisbaum.
Checkbook recently updated its ratings for vets in Boston, Chicago, Minneapolis, St. Paul, Philly, San Francisco, Seattle, and Washington, D.C. And we learned a lot from the feedback we got from subscribers from more than 1,500 veterinary practices. In this episode of Consumerpedia, advice on how to find a good vet for your pet, how to deal with the increasing cost of veterinary medicine, and we'll look at the pros and cons of pet insurance. Checkbook's executive editor, Kevin Brassler, is here to talk about all this. Hey there, Kevin.
Hello, Herb. How are you?
Good. I just want to point out to our listeners that my producer, Sam, my dog, is sitting here in the room with us, and if you hear him bark or growl, it's probably because there's a squirrel near the window and not because you said something he didn't like. So I just want to clarify that right away, okay?
And I'll clarify that I've locked the cat out of the office, so we won't be hearing the cat.
Oh, no piano playing from the cat, huh?
No, none of that.
What do you think the number one thing that we learned from doing the survey of our subscribers across the country about the veterinary care that they get?
The first thing is that the veterinarians mostly got really high ratings from their surveyed clients. Apparently caring for animals usually translates into being, good people. Most of the practices received really high marks for communication and explaining things clearly, their apparent competence, and most of all for compassion, for caring about the pets. Mm-hmm. But as with any type of service, our ratings did find a few stinkers out there that you want to avoid. But overwhelmingly, the vet practices got high ratings for the things you'd hope they get high ratings for.
Any other areas of concern that you want to share with us?
The one area where most practices got pretty low ratings that were so low it's concerning, is a survey we questioned that asked about helping keep pets' medical costs down. A lot of consumers questioned why veterinary care is so expensive. We received really an alarming number of reviews that wondered whether or not their vets were pushing them to get too much treatment. And, this is an ongoing issue, not just with pet care, but with human medical care and with dentistry, that there's unfortunately a conflict of interest at play here, where the more care the service provider can provide, the more money they'll earn. And with pet care, many consumers have limits in terms of what they're willing to pay, and a lot of them were expressing concerns about, that they were being urged to get care and agree to do care that they just couldn't afford to pay for. And then another problem was the vets, and sometimes doctors do this also, they didn't do a very good job at explaining why specific care was really needed and providing information on all the different treatment options that might have been available, because often there's more than one option.
I think a lot of this may also have to do with expectations. I don't think a lot of people, unless your animal is sick or injured, they don't realize how expensive veterinary medicine care is right now. I mean, there are veterinary cardiologists and ophthalmologists and radiologists and oncologists, and the treatment level has gone up dramatically in the last few years, and it is a lot more expensive to take care of your pet, and this may be a reason why people are surprised at what they're being asked to pay.
Yeah, and the overheads have gone up. And they have to have different imaging equipment and things like that. These things cost money, and it costs lots of money. It costs lots of money for human medical care and for veterinary care. The difference is that for human care, you rarely pay, 100% of the costs. There's an insurance plan that's picking up a tab, and that insurance plan may have even negotiated lower rates for you, and you don't even know it. Mm-hmm. For veterinary care, the expenses loom a lot larger because they're right there. It's going to be $2,000 for whatever services you need. There's clearly a disconnect between what veterinarians are able to do and what their patients and consumers are hearing, that they're not really hearing about the treatment options and maybe alternative treatments, or, it's not being explained very well why the animal needs the specific care that's being recommended.
So it sounds like you, the pet parent, need to have conversations with the vet if they suggest something, which isn't all that easy with COVID because you can't even get in the place sometimes, but to find out why is this necessary? Is there another alternative? I guess you could get a second opinion opinion, but unlike with people medicine, where insurance is going to pay for a second opinion, you'd have to pay for that on your own.
Yeah, it's a problem. And it's a problem with human medical care. A physician recommends a certain course of action, and physicians aren't always necessarily good about explaining what other treatment options there might be. But as you said, second opinions are for veterinary care can cost extra money, and it might be the case. But I do think that second opinions, not just in the world of veterinary medicine, but human medicine, are really the most underutilized tool for getting it right and getting the right care. Because sometimes it's not cut and dried what you should do, and sometimes there are misdiagnoses. I mean, there's just lots that can happen. And so second opinions are very important, and I think pet owners should take advantage of them more often than they do.
Let's talk about price for a second. I know that Checkbook secret shoppers price shop for various procedures, the same procedure, different vets across the country. What did you find?
So our researchers called veterinary practices, and they asked for pricing without disclosing an affiliation with Checkbook. They asked for pricing for very clearly specified aspects of care. Spaying of a 7-month-old 25-pound dog without hospitalization. And they also made sure they got pricing for pre-op appointments and post-op appointments and any drugs that were needed. Mm-hmm. And when they asked for these prices, we found huge differences from practice to practice for the same care. So for spaying a 7-month-old dog, the lowest price they were quoted in the Washington, D.C. area where I am was $235. And the highest price they were quoted was $1,400. Each of the 6 different procedures and treatments that we asked for pricing on, so lab analysis of a dog's stool for worms, spaying of a cat, euthanasia of a cat, neutering of a dog, routine teeth cleaning, we found these massive price differences where some practices charge 3 times more than others for really the same care. Big price differences.
And what about the relationship between price and the quality of care the animal gets?
Yeah, so you say, well, it's fine to save money, but I don't want to take my furry little friend to some cut rate place that's going to offer bad care. But that's not the way it works at all. There's no relationship between quality and price. We found that the vets that get really high ratings from their customers for quality of care are just as likely to offer low prices as they are high prices. So you can't assume that a high price is going to mean better care. And in fact, you shouldn't assume that at all. You should seek out the best veterinary practices, but also make sure you're not overpaying. And that's what our ratings for price will help you do is find and identify the high quality, low price practices.
So one way to avoid high vet bills is to buy pet insurance. We're going to talk about the pros and cons of that when Consumerpedia continues.
Looking for a vet? Checkbook can help. We have customer ratings and evaluations for vets in these 7 metro areas: Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. The ratings are available with a subscription. Tips on how to find the best vet for your pet is free to everyone at checkbook.org. If you live in one of these 7 areas and haven't joined Checkbook yet, check us out. Get a free 30-day subscription by going to checkbook.org/Consumerpedia.
So Kevin, let's talk about pet insurance. There are pros, there are cons. Checkbook looked at both, and let's talk about that.
Yeah, it's interesting. Until recently, very few American consumers bought pet insurance. For a long time, only a few companies sold it. And what they sold was actually pretty lousy coverage. But it's becoming much more popular now. And along with that, because now there's more companies selling it, there's more than a dozen now. Because there's more competition, I think, and more people interested in it, the coverage has gotten better. Really, though, I think consumers still need to understand that this is an expensive purchase, and they need to be really careful about what they buy and the companies they pick to carry their coverage, because their coverage is going to last for a long time, for 10 plus years. And so they need to understand what they're buying. What we've done is we've evaluated the coverage and costs available from about a dozen companies and really try to break down which companies offer the best coverage and who should be thinking about buying this insurance to begin with.
So some companies try to get you in early with a low premium, and then it really goes up as the pet gets older, but some don't do that. They just do it based on the price of medical care in the area. Tell us what you found about that sort of thing.
So here's the thing about pet insurance. It's an expensive purchase, and I don't think many pet owners understand that when they buy it. And the reason is that this insurance coverage is advertised at really low rates, that for only $30 or $40 a month, you can get this peace of mind policy and not have to worry about expensive vet care costs. And while it's true at first you're going to pay a low premium, what most pet owners don't understand, because a lot of pet insurance companies, they use misleading marketing, they don't explain that as your pet ages, ages, most of these insurance companies are going to jack up your premiums. And we're talking about for a mixed breed dog, when it reaches 10 years of age or older, you might have to pay $250 or more per month to continue coverage. So what they're doing is that, early on when you have a puppy and it doesn't need much care, premiums are going to be cheap. Down the road, when the dog gets older, now all of a sudden when you actually will need the coverage for illnesses, that's when they jack up the rates. And a lot of consumers drop coverage because the pet insurance policy has just gotten way too expensive for them.
Now, doing the undercover price shopping, we found one company, happens to be located here where I live in the Seattle area, that doesn't raise the rates as a pet gets older.
Right. We don't think that Trupanion does what the others do. Trupanion will still increase your rate each year to account for overall increases in veterinary care costs and maybe your claims history. But for the most part, the base rate you pay when you start coverage with Trupanion is what you'll pay later on. The other pet insurance companies, they don't operate that way. We looked at them when we found that, as pets get older, once they reach 10 years or older in age, now the rates are so expensive that most consumers will drop coverage. And they're designed for that, right? They're designed to cover risks that you're not likely to have when the pet's younger, and then to try to, make things so expensive later on that people won't maintain coverage or will just pay so much money that it's really not worth the coverage at that point.
So I'm just going to share a couple of thoughts about pet insurance. You know how I feel about it, Kevin. I'm a believer in it because I've talked to people who literally had to put their pets down because they couldn't afford an expensive procedure. Yeah. Some people can afford $60 a month, but they can't afford $5,000 all at once. So a lot of it has to do with how you feel about your pet. My pets, they're members of the family. I do anything for them. Some people just don't feel that way, or what you can afford financially. But a couple of things. Number one, just because a pet is young does not mean there won't be medical expenses. I talked to a woman whose Labrador ate 4 tennis balls and it was a $4,000 procedure. The lab was a year old. Or a dog can get hit by a car or something like that. But also what we talked about before, the staggering cost of veterinary care. My dog, Sam, got lepto, bacterial disease, and 5 days in ICU was $10,000. Insurance picked up $9,000. So that's the kind of cost-benefit analysis that needs to be done as well.
We looked at pet insurance plans using 2 different approaches. One was, what happens, what's the math look like if I don't need a lot of care over my pet's lifetime? And in those cases, pet insurance doesn't make any sense at all. Because the premiums are expensive, because it doesn't usually cover wellness visits, because there's so many copays and deductibles involved, you come out far, far behind if you buy insurance compared to just paying out of pocket for everything. Mm-hmm. It is only when a pet needs a lot of medical care, when you're really unlucky, like Herb with his dogs, right, that pet insurance begins to make financial sense. But of course, that's why people buy insurance in the first place, is to insure against the risk of having really expensive bills, right? Having really expensive healthcare expenses if you're for humans, right? Having a fire in your house that destroys this big investment, having a car accident where you get sued for liability issues. You buy insurance against those risks, and pet insurance makes sense to buy insurance against the risk of having a big vet bill if you are of the mind of, I'm willing to pay anything to care for this pet, right? I'm willing to pay anything to pay the medical expenses I might have to incur to keep this pet healthy. Mm-hmm. I just think it's important that overall people need to go into this understanding that while the pet insurance companies make these plans seem really affordable, that there's more expenses that you will confront here other than the premiums you pay each month. First of all, the premiums may get so expensive you can't afford to keep coverage. But secondly, there's always going to be copays and deductibles that will increase your costs. So we did look at, high use pets that got really unlucky and needed a lot of care. And even then, were we better off having pet insurance? Yeah, but it wasn't clear cut. There were a lot of cases with a lot of insurance companies where we were still, because the insurance was so expensive, we were just better off not having it. And so that's why I think it's important people really pay attention to what's covered, what isn't covered, and go with a company that we've at least evaluated as being a low-cost company over the life of an unlucky pet.
And as I pointed out to you as we've discussed this privately, you don't know whether you're going to have a pet that's going to need it or not, just like you don't know if a child's going to get sick. I had a cat that had cancer, had to have an oncologist. I had a dog that had a bacterial disease in the eye, needed a radiokeratotomy treatments from an ophthalmologist. I'm willing to pay anything for my pet, so it makes sense for me. And if you're willing to be that person who can't afford $5,000 at one pop, but maybe can afford the premiums. One other thing I'd like to point out is if you're shopping for pet insurance, find out if the insurance, and I think our our research shows that Trupanion is probably the way to go. But find out if you have a breed that has hereditary problems, will that insurance cover those hereditary problems that you know is going to happen down the road? Some now do. It's starting to be that way. Most don't. That's a really critical thing to find out.
It's a really good point, Herb. And you also need to understand that, our modeling, what we looked at was a mixed breed dog. If you have a purebred dog, you really need to pay attention to the insurance policy you're getting, because a lot of these insurance policies, what they'll do is if they know there's a problem that's specific to a breed, that breed will tend to have that problem, some of these companies will just exclude it from coverage, right? And it's in the fine print in your contract. The other thing they'll do is if you have a pure breed dog and it has a lot of health problems, like some breeds have more problems than others, your rates will be a lot higher. For example, our mixed breed dog, we were only going to pay, $40 or $50 a month to start, right, as a puppy. But if it were a purebred dog, for some breeds, we'd pay 3 times as much. So these companies are really paying attention to what they are likely to have to pay out and covering themselves for that in the form of higher premiums or excluding care. A great point you made, Herb, was that congenital problems aren't always covered by these policies. Historically, they didn't cover those problems at all. They've gotten better about it, but some plans, some companies have better policies than others for that. The other thing you need to be really worried about here is that most policies won't cover pre-existing conditions. And this is the big gotcha with these plans, that if you don't sign up early, if you wait until your pet has a problem, and then you say, aha, now I'm going to get insurance, and I don't have to pay for all this, the cancer treatments. Well, now it's too late. So it does make sense to start early. Just make sure you start early with a plan that's the best fit for you and will actually cover the things that might go wrong with your specific pet.
And one thing I want to emphasize that you mentioned before, which is some of these companies sell wellness policies. Wellness policies clearly don't make a lot of sense. You're going to pay a lot more than you're going to pay for a wellness checkup kind of thing. If you're going to get pet insurance, just get it for the potential high loss that you could have from medical expenses. Don't even think about getting these wellness plans.
Yeah, don't. They're not worth the money at all. And actually, in wellness checkups, things like that, lab tests, that's something you can budget for. You don't need to pay an insurance company a certain amount of money each month to budget for that. Even if you're worried about big costs for checkups and labs and things like that, just know that the coverage for that type of service, it's just too expensive. It's not worth buying at all.
By the way, we have a big article all about this on checkbook.org. It's also one of the feature stories in the latest magazine issue. Just go to the website and check it out, and there's a lot more information than Kevin and I could possibly talk about. We're going to come back with a few last thoughts right after this.
Consumerpedia Fast Facts. A dog's sense of smell is 40 times better than a human's. And get this, they can sniff and breathe at the same time. Cats spend about 70% of their lives sleeping, which works out to around 13 to 16 hours a day. Guinea pigs don't come from Guinea, and they're not related to pigs. They have 4 toes on their front feet, but only 3 on their back ones.
So Kevin, let's just talk about a couple of things with veterinary care. We mentioned it earlier on, how important communication is. And like with people medicine, if you're not happy with the treatment you're getting, speak up, say something. We have a veterinary clinic that we love, but we had a doctor there that we just didn't like. We changed. Just like once I changed the people doctor because I didn't like the communications that were going on with this doctor. We talked to the staff off the record. Hey, which vet would you get for your pet? And found somebody we really liked, communicated with us, explained things with us. We also had a cat vet who left the practice, started his own practice, and we followed him because he was so amazing. It really is like all medicine has a lot to do with communications and bedside manner above and beyond what kind of qualified doctor they are.
Yeah, I agree. And taking charge of your own medical care, or in this case, your own pet's medical care, is really important. The entire medical community in general is finally moving toward this. It used to be this, the doctor told you what you needed and that's what you did. And that was true of veterinarians also. They told you what you needed and that's what you did, or you euthanized the pet. Those were your choices. Yep. But there's usually, as we mentioned before, there's lots of different treatment options. And everyone should be involved in their own care. And so you should be able to feel comfortable questioning the diagnosis and communicating with the veterinarian about what is and what isn't best course for you. There's often usually not just one path to follow, not just for human care, but for veterinarian care. And they need to respect that you might have a different outlook here in terms of not just really what you're willing to pay for, but, how much work you're willing to do, how many treatments you think your pet is willing to suffer to get better. And so these are important things that your veterinarian should give you plenty of time to discuss with him or her and not rush you into decision or be so heavy-handed in terms of, well, this is the course of action to take, and that's it.
And I've been lucky because with the conditions my guys have had, the vet always explained, with a cancer, we can do this or we can do this. This has this side effects, this has this side effect. By the way, at least in my area, in the greater Seattle area, the veterinary hospitals, they tell you after they do an initial diagnosis, this is going to be between $3,000 and $5,000 to start whatever we're going to do. And then if we find something, it's going to be up from the, can you handle that? I think that's really a good practice, especially a hospital where it's going to be pretty staggering cost to most people to lay it out on the line right up front and give you an idea of what it's going to cost as opposed to a surprise at the end, which is totally going to freak people out.
This is important for human care, that you have some idea as to what you're going to pay for care, but also it's especially important for veterinary care because they need to know up front, this is how much you're going to pay. So it's reasonable to request a written treatment plan with a cost, so you know what you're going to have to cough up before you agree to it.
And one last thought, I know I sound like Bob Barker, but spay and neuter your pets.
Yeah.
And go to get a pet if you can from the local shelter. They're just overflowing with great, wonderful animals. We've had 4 shelter pets, and they've just been absolutely wonderful. You can do something good for the world at the same time you're doing something great for your family.
I agree. I mean, despite Herb's really bad history with vet expenses, he's overall, I know, loves his dogs. Just even the one that swallowed the tennis balls.
And the cats. No, my dog didn't swallow tennis balls. Somebody I talked to swallowed the tennis balls. And listen, my people medicine bills are horrendous too, but we are getting older, so what can I tell you,
I do think that whether you have insurance or not, whether you buy insurance or not, make sure you're not overspending by using an expensive vet, that you really want to seek out veterinarians that have low costs. Just know there are big cost differences, and those cost differences will make a difference to you even if you have insurance, because the pet insurance companies have limits in terms of what they're willing to pay out for each procedure. And so if your vet charges twice as much as the pet insurance company is willing to pay out, you're going to have to make up the difference. It's called balance billing in the world of human medicine. It also exists with veterinary care, and you just need to be aware of that.
Well, a good discussion this time. And I'm going to go take Sam for a walk, and you can take your cat and play with a laser thing or something and have some fun.
Yeah, we'll see. I'm sure she's asleep somewhere. So,
well, that's it for this edition of Consumerpedia. Thank you for listening. You can subscribe to us on Apple or Google Podcasts, Spotify, Stitcher, or wherever you listen to your podcasts. That way, you won't miss any episodes. Another way you can support this show is to follow us at Consumerpedia on Facebook and Instagram, or at My Consumerpedia on Twitter. I'm Herb Weisbaum. Thank you for listening.
Consumerpedia is a public service of Checkbook.org. We're a unique nonprofit that empowers you, the consumer, to save money and make smarter choices. From auto repair shops to doctors, plumbers to vets, you can count on Checkbook.org to help you find the best services and avoid the worst. Local ratings are unbiased and accurate. If you live in or around these 7 cities and haven't joined Checkbook yet, check us out. Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. To get your free 30-day subscription, go to checkbook.org/Consumerpedia. Consumerpedia, empowering consumers to save money and make smarter choices.